Mr. Cook?
It's about time, nurse. I have been waiting here for nearly a half hour.
I am so sorry for the delay. My last surgery ran long.
You're a doctor?
Dr. Jackson, I'll be your surgeon today.
There has to be some kind of mix-up. I was told I was getting the best surgeon in the state.
I'm flattered. Whoever told you that, well, that was very nice. Listen, can you just hang tight a couple more minutes? My nurse will be out to get you prepped in a minute.
Excuse me. How come no one told me Dr. Jackson's a woman?
That's not something we usually think of doing.
Of course not. Because if you did, no one would show up. So instead, you mislead your patients into thinking we're getting real doctors. And then when we show up, you give us the old bait and switch. I should call the Better Business Bureau and report you.
I'm not sure what you want me to say, sir.
What I want is for a man to perform my surgery, not a woman playing dress up. I'm getting my hip replaced. I can't afford to have some affirmative action hire screwing it up.
That's not possible, Mr. Cook. All of our other orthopedic surgeons are booked.
Until when?
The next opening with a male doctor is in 3 months.
I can't wait 3 months. I have a $50,000 vacation plan that is non-refundable, and I can't go without a new hip.
Let me assure you, Dr. Jackson is a highly accomplished surgeon. You're in excellent hands.
Excellent. How can you even say that with a straight face? Look! She's already running late, just like a woman. So how's that supposed to reassure me?
Sir, it's only 5 minutes past your scheduled appointment. The nurse will be right with you. Please take a seat.
This is ridiculous.
Mr. Cook, we're ready for you now.
Great. Female doctors and male nurses. What is this, crazy town? You're really a nurse?
For the past 8 years.
How'd that happen?
3 years of school is how that happened.
No, I mean, how did you end up doing women's work?
Just lucky, I guess. Now I'm gonna go ahead and take your vitals.
Great, so not only do you do a woman's job, you also work under a woman. Don't you have any self-respect?
Well, I like to think that I work with Dr. Jackson, but yes.
Can't imagine how ashamed your family must be.
Ashamed. Dr. Jackson is at the top of her field. I'm very proud to be working with her. I learn something new every day.
Like doing the laundry?
No, believe it or not, I'm very grateful to be working with Dr. Jackson, and you should be very grateful to have her as your surgeon.
You can drop the platitudes, man. I know you gotta say nice things because she's your boss, but you hate working for her, don't you?
No, not at all. Why don't you go ahead and get changed into your gown, and I will go ahead and get your doctor.
Mr. Cook, good to see you again. This should be a very routine procedure. Are you excited about your new hip?
Excited? I'd feel a lot better if I didn't think you were gonna screw it up.
Well, don't worry too much. I've done many of these.
Okay, how can I not worry? Look at you.
What's wrong with the way I look?
Nothing. I mean, you're objectively an attractive woman, which makes me suspect that it wasn't just good grades that got you through medical school.
So your vitals are looking good. We should be able to get you in and out of surgery within a few hours.
Don't rush through this. Now, I need you to be on your absolute A game. Got me?
I promise you, Mr. Cook, I will do my very best.
Try your best? Losers say they'll try their best. A man would know better than to think that way.
Sir, do you have a problem with me performing your surgery?
Yes! You're a woman! You have no business being a surgeon.
I can assure you, Mr. Cook, you are in very capable hands.
Relax, sweetheart. She's your boss. I know you gotta say that.
I have performed this surgery hundreds of times. I promise you, you'll be very pleased with the results.
Well, right now I'm feeling pretty uncomfortable.
I know. Surgery can be scary.
It's not the surgery that scares me. It's you. I want a man to do my surgery, someone who knows what they're doing.
Okay, if that's what you really want, I'll see what I can do.
You do that.
Mr. Cook, you're in luck. Dr. Williams here is available to perform your surgery.
Thank goodness, finally someone competent.
Well, Doctor, I will leave you to it.
Thank you.
I can't tell you what a relief it is that you're doing my surgery, Doc. You're a lifesaver.
I should be the one thanking you.
Why would you be thanking me?
Well, if you hadn't requested a male surgeon, I never would have been allowed to do this procedure on my own. At least, not this early in my career.
So you've never done this surgery before?
No. But I've observed Dr. Jackson do it a bunch of times. She's really a magician in the operating room. I'm lucky to have gotten the chance to learn from her. You know, she's the best in the field for a reason.
Is she really that good?
Are you kidding? There's not an orthopedic award she hasn't won. In fact, she pioneered several of the surgical techniques I'll be doing today. But between you and me, I only hope I can do them half as well as she can.
Excuse me a moment, Doc. Dr. Jackson, I've reconsidered.
Reconsidered.
Yes, I'd like you to do my surgery as originally planned.
Well, I'm afraid I can't do that. You've made it very clear how you feel about my skills as a surgeon.
Fine, I'm sorry. Is that what you want to hear? Now please stop wasting time and prepare me for surgery.
Mr. Cook, do you have any idea how hard I've had to work to achieve any success in the medical field? Or how many times I was underestimated by patients or colleagues who thought less of me just because of my gender? No, of course you don't, because when you looked at me, you didn't see a competent medical professional. You saw a woman playing dress up. And then you had the gall to accuse me of sleeping my way through medical school. Do you have any idea how hurtful that is? I've had to deal with this kind of toxic misogyny since medical school, and frankly, I have had enough of it.
Okay. I think the nurse slipped me some pills earlier. I'm feeling really loopy, and I did not mean a thing I was saying earlier. I really didn't.
He did no such thing. You meant every hateful word that you spewed. But the good news is, I don't have to put up with that kind of abuse. Not from you, not from anyone. Now, if you'll excuse me, I have another surgery to prepare for.
Please. Look, I'm begging you, okay? I need you to do this surgery for me. I have a very expensive vacation plan, and I absolutely can't miss it.
Well, I guess you should have thought of that before thinking less of a woman.
Can I help you?
Yes. I want Dr. Jackson to do my surgery as originally scheduled.
I'm afraid I can't do that.
Sure you can.
I'm afraid not. We already changed surgeons once on your request. We can't do it again. Besides, as you just heard, Dr. Jackson has already booked another surgery for this morning.
So I'll wait a few days. When is Dr. Jackson available next?
Not for another 6 months. She's in high demand since she's one of our hospital's most esteemed surgeons.
Come on. You can get me back on her schedule.
It's just not possible, sir.
It's not possible, or you just don't want to do it.
All right, Bobby, you prep to get prepped. Whoa! Whoops. Sorry about that. Guess they don't call me Butterfinger Ben for nothing. Mr. Cook, I need to get you prepped for your procedure. Are you coming?
I'm coming.
Red is what?